an idea, my vocal cord would be here somewhere, I'll start attempting the injection. So let me just emphasize, normally I always prefer the cricothyroid procedure, sir, but there are instances where the patient is really apprehensive or really obese, bulky. We are not able to see or not find out the cricothyroid space, or the needle doesn't end up in the space as expected. In those cases, and also in the COVID times when we were scared about the aerosol, at those times also thyroid injections came into the forefront. Easier and possible probably only in the young patients wherein the cartilage is not ossified. In ossified cartilages also you can attempt, might be a little bit difficult as in against the non-calcified areas patients. So here you choose your location, because the number of times you keep on poking in, it becomes more and more bloody, which keeps on making the patient cough. So the number of piercings should be limited. So once you find the location, you find out the midline. Is it visible? Yeah. From the midline, in the along the length of the expected area of the vocal cord, around 7 millimeter away from your midline, the way we do it for thyroplasty as well.
Is the distance same for the male and the female?
Sir, 5 mm and 7 mm is what we say, but I would rather stick to 7 mm because you don't want to be too anterior. Too much of injection in the anterior part will actually worsen the voice. So you want more of it to come into the posterior part. So I'll rather stay in the posterior portion rather than getting too ahead and close to the anterior commissure. Any swelling near the anterior commissure will worsen the voice more than it is expected. So just to stay away from that area, I'll choose a safer area which should be around 7 mm from the anterior commissure, more so in the males, also in the females I would. And then rather than slanting it like anyways, I would rather keep the needle perpendicular. That is important. I don't keep it like this, I don't keep it like this, I keep it perpendicular so that I try entering the vocal cord, and you can already see the...
Yeah, we can see the needle.
Yeah. So this, the human vocal, the normal vocal cord doesn't pierce off like this. It is really tensile, elastic, doesn't give way through. This being a cadaver, it's very easily...
What size needle do you use for transthyroid injections?
Same, sir. 25 and 27 gauge. In cartilaginous, they are easy. Only thing is that they get blocked at times because of the cartilage, and if ossified, all the more the chance of getting blocked. In that case, you'll have to take it out or and do it again. So little bit messier as against the cricothyroid, but definitely you need to be aware about it because there are instances wherein your cricothyroid might fail you. So you always need to have a backup plan. This looks good enough for a backup plan, sir. Yeah. So can we appreciate the tenting, the movement?
Yeah.
Yeah. So once we are there, this is bang on that paraglottic space, sir. Just exactly where you want the injection to be, the material to be. And once you are there, you start injecting. I'm pretty sure it will start leaking again. Yeah. So if it didn't leak, it would have given a good bulge. Right now also it's getting inside. Can you see it's medializing?
Yeah.
So it will just plump it up.
So just two questions here.
Yes, sir.
How much do you inject normally?
Sorry, sir?
How much do you inject? How much?
Sir, normally one vial has 0.5 cc. Normally that is enough when the gap is small.
So 0.5 cc's is enough?
Yes, normally, sir, but yeah, not for everyone. At times I have needed 2 vials. So we don't stock more than 2 vials in our hospital. So I always, once we had an issue like we were having only a single vial, I did the injection, I realized it wasn't enough. I needed another vial, didn't have it in-house. So always, so this is one point, again we need to be careful. The injection is available. Don't expect that always one vial will suffice at times, and the cost also goes up. It is around 22,000 or something. You need to be telling the patient at times 1 vial or even 2 vials might be needed. The cost might go up. So when when the gap is bigger in older patients wherein the atrophy is also there, you might need a little bit more amount apart from that your routine 0.5 cc. At times only 0.2, 0.3 cc might also suffice. So it's not the amount, sir. It's the time wherein the vocal cord adducts beautifully. Definitely you are doing this procedure awake and you are asking the patient to phonate after your injection, and that's the way you realize how much will you be injecting. So once they phonate and the gap is closed, the voice is good, you stop there. A little bit of over injection won't be harmful, but under injection might not be a good idea.
Yeah. Second question was
Yes, sir.
if there is a extrusion or extravasation and then that's aspirated.
Nothing happens, sir. They cough it out. We ask them to cough it out. Often it extravasates at the point of injection when we take out the needle. So that is not at all an issue. They cough it out. It's not much. But for us, it's an issue that because we have already bought the injection and you don't have any extra material there. 22,000 is at stake. So in that way, it is a loss. But for the patient, nothing much.
Right. Okay.
Yeah.
Dr. Rajida,
yes, sir.
I have one question. Do you ever do injection laryngoplasty under general anesthesia using microlaryngoscope and long laryngeal needle?
Sorry, sir, I didn't get it. Which needle am I using under GA? Is it, sir?
A long laryngeal needle using micro scope.
So normally we use the butterfly. Can you see here?
Okay.
Yeah.
Okay.
So normally we have our MLS forceps.
Okay.
We cut the sides. The flange doesn't enter your rigid laryngoscope.
Okay.
So normally we cut it on the sides.
Okay.
We use a pink colored needle
Okay.
for the fat, which is the 18 gauge.
Okay.
Because this thing doesn't go hyaluronic acid, you can use smaller needles, 22 or 24.
Okay.
And with the help of your forceps, the MLS forceps, you hold, is it visible? Yeah. You hold it like this.
Okay.
And your assistant has to be equally good
Okay.
because the fat which is taken with so much of difficulty tends to leak at this site.
Okay.
So you fit in the needle here. So what I always tell my staff assistant is that to hold it here as well. Is it visible? Yeah, to hold it here as well so that it doesn't leak from here, because hyaluronic acid or fat both are expensive. You can't afford to lose it. And then slowly they start injecting. Once I am at my location and happy with the location, we start injecting. For rinky space, usually it will be hardly 0.1 or max 0.2 mm. For paraglottic, it might be around 0.34 or 0.5 mm, depending upon the medialization, like that.
Yeah. So
smaller, finer needles ensure that the puncture site doesn't turn into a leak site the way it turned out just now in our procedure here. Here, because of the issues with the piercing, we took a bigger needle. But the smaller the needle, your puncture site is smaller, the chances of leak from that site are lesser. And definitely under GA, when we are doing, the extubation is as important as the procedure. We ask them to do it. Avoid a cough, if at all possible, like that.
How do you prepare the fat, madam?
Sir, for us, usually we take it from the abdomen, sir. We mark a point on the line from the umbilicus to the anterior to the iliac spine. 2/3 medially and laterally 1/3. That point we inject with lignocaine and 50 ml of saline and lignocaine with adrenaline, and we wait for 20 minutes. Fumescent specific recall.
Yes.
Son? Right. Stalin? வாங்க.
Check audio.
வருதா? Okay. Right. So, இந்த கதவு சாத்திருங்க. ஓகே. பாலாஜி மருத்துவக் கல்லூரி குரோம்பேட்டில் இன்று நாங்கள் செயல்முறை பயிற்சியும் ஒரு கருத்தரங்கும் வாய்ஸை பற்றியும் சோலோவிங் ஆஃப் ஃபுட்டை பற்றியும் நடத்தி கொண்டிருக்கிறோம். இதற்கு இந்தியாவிலிருந்து 100க்கும் மேற்பட்ட காது மூக்கு தொண்டை நிபுணர்கள் வந்துள்ளார்கள். அவர்களுக்கு வாய்ஸ் சம்பந்தப்பட்டதையும் சோலோவிங் எப்படி பேஷண்ட்டுக்கு முழுங்க வைக்கிறது என்பது, அதாவது ஸ்ட்ரோக் பேஷண்ட்ஸுக்கு சரியாக முழுங்க முடியாது, அவர்களுக்கு எப்படி சோலோ பண்ண வைப்பது என்பது பற்றியும் ஒரு செயல்திறன் பயிற்சியை நாங்கள் வழங்கி கொண்டிருக்கிறோம். இதன் மூலம் அவர் பயிற்சி பெற்ற பிறகு இந்தியா முழுவதும் அவர்கள் சென்று இந்த பயிற்சியினை வைத்து மற்ற பேஷண்ட்டுகளுக்கு அவர்கள் வைத்தியம் பண்ணுவார்கள், ட்ரீட்மெண்ட் கொடுப்பார்கள். இதில் என்னவென்றால் ஆண் குரலை பெண் குரல் ஆக்குவதும், ஃபார் எக்ஸாம்பிள் டிரான்ஸ்ஜெண்டர்ஸ் அவங்க ஆண் குரலை பேசுவாங்க, அவங்க எல்லாமே பெண் போல இருப்பாங்க. ஆனால் நாங்கள் அதை பெண் குரலை மாற்றி அவங்கள ஒரு நார்மல் பீப்புளாக ஆக்கிறோம். ஏன்னா டிரான்ஸ்ஜெண்டர் இப்போ ஒன்றாவது ஜெண்டர்ஸாக நம்மளை ஆகிட்டோம். அதே மாதிரி பியூபர் போனியான்னு சொல்லுவோம். 21 வயசு ஆகிருப்பான் பையன், ஆனால் அவனுக்கு குரல் வலை உடையாது. அதனால் அவன் ஃபீமேல் வாய்ஸ்லேயே பேசிகிட்டு இருப்பான். அவனுக்கு அந்த வோக்கல் கார்டை கொஞ்சம் கரெக்ட் பண்ணணும்னா அதில் அவன் மேல் வாய்ஸ் ஆகிடுவான். அவன் நாளைக்கு ஸ்கூலுக்கோ காலேஜுக்கோ போனாமா அவன் கூச்சம் இல்லாமல் இருப்பான். அந்த மாதிரி எங்ககிட்ட நாங்கள் நிறைய பேர் பண்ணிகிட்ருக்குறோம் குரோம்பேட் பாலாஜி மெடிக்கல் காலேஜில். அதை ஒர்க் ஷாப் மூலம் கேடவரில் டிசெக்ஷன் பண்ணி அதை எப்படி அந்த குரல் வலையை ஸ்ட்ரைட் பண்ணுறது, குறைக்கிறது என்பதை ஒரு ஒர்க் ஷாப் மூலம் நடத்தி 100க்கும் மேற்பட்ட காது மூக்கு தொண்டர்களுக்கு நாங்கள் பயிற்சி அளிக்கிறோம். இதன் மூலம் இந்த ஒரு விஞ்ஞான ரீதியான முன்னேற்றத்தை மக்கள் எல்லாருக்கும் சென்றடைய வேண்டும் என்பதுதான் எங்களுடைய நோக்கம். ஆமாம், குரல் பேச்சும் ஒரு மனிதனையும் சம்மந்தப்படுது. அதாவது பர்சனாலிட்டியே குரலில் தான் இருக்குது. நீங்கள் எப்படினாலும் இருக்கலாம், குரல் நல்லா இல்லைன்னா அவன் பர்சனாலிட்டியே கிடையாது. அதனால் இந்த பர்சனாலிட்டிக்கு குரல் எவ்வளோ முக்கியம் என்பதை இந்த கருத்தரங்களை நாங்கள் விளக்கி கொண்டிருக்கிறோம். இதில் ஒரு சிங்கர்ஸுங்களையும் நாங்கள் கூப்பிட்டு வச்சு வாய்ஸ் சாரகம் சொல்லிட்டு ஒரு சுழற்சி முறையில் பேச்சு எப்படி சுழற்சி முறையில் கொண்டு போகிறது, அதாவது ஹை பிச்சு கொண்டு போகிறது, லோ பிச்சு கொண்டு போகிறது, அதே நேரத்தில் பேஸ் வாய்ஸில் பாடுறது என்பதை பற்றிலாம் ஒரு சிங்கர்ஸ் கூடயும் நாங்கள் அது ஒரு கருத்தரங்கை வைத்திருக்கிறோம். இப்போ குறிப்பாக இப்பொழுது வீரமணி ராஜ் அவர்களும் அப்புறம் சிவசிதம்பரம் அவர்களும் அவர்களுடன் நாங்கள் கலந்துரையாடி இன்னும் இதை எப்படி வாய்ஸை நல்லா பண்ணுறது, அவ்வளோ பேசிக்காக மக்களோட கலந்துரையாடி அவங்க வாய்ஸ் என்ன சொல்கிறாங்க அந்த வாய்ஸுக்கு தகுந்த மாதிரி எங்களுடைய மக்களுக்கு வாய்ஸ் கொடுக்கறது. அதாவது ஸ்பீச் போயிடுச்சுன்னா பாடகர் இருப்பார், பெரிய பாடகராக இருப்பார், திடீர்னு ஒரு நாள் அவரால் பாட முடியாது. அப்படி பாட முடியாதவருக்கு அவன் எந்த மாதிரி ரெஸ்ட்டு, எந்த மாதிரி ட்ரீட்மெண்ட் கொடுத்து அவர் மீண்டும் பாட வைப்பது தான் இந்த கருத்தரங்கின் நோக்கம். ஆமாம், இந்த எங்களுடைய ஸ்டூடெண்ட்ஸு, எங்களுடைய பல இப்போ இந்தியா முழுவதும் வந்திருக்க டாக்டர்ஸ்க்கு இது கொஞ்சம் தெரியாது. ஏன்னா இது லேட்டஸ்ட் டெக்னிக்கு. ஸோ இதன் மூலம் மற்றவங்களுக்கு தெரிய வச்சு இதை இந்தியா பூரா யூஸ் பண்ணணும்னா இது மக்களுக்கு யூஸ்ஃபுல்லாக இருக்கும். டாக்டர் M.K. ராஜசேகர், காது மூக்கு தொண்டை நிபுணர், அண்ட் HOD of ENT Department of Balaji Medical College, Chennai. Right. இப்போ இந்த சிங்கர்ஸ் ஃபோட்டோ எடுத்துடலாமா? கொஞ்சம் வந்திருக்காங்க, வீரமணி ராஜும் சிவசம்பரம் இருக்காங்க. ஒரு வீடியோ ஃபோட்டோ கொடுத்துட்றோம் கலந்துக்கிட்ட மாதிரி. ஏன்னா அந்த சுழற்சி முறையில் பேச்சு இருக்குல்ல, வாய்ஸ் சுழற்சி, அது என்ன பண்ணுறது, இசை உரையாடல் இருக்கு. அது அவங்க பேசும்போது எடுத்துடலாம்ல, அங்கே சாதக மாதிரி ஒரு பண்ண போகிறோம். பார்த்து யாரா யார் அடிக்க சொல்கிறான்? அது ஆமாம், அவங்க ஒரு செலிபிரிட்டி தான் போடுவாங்க எல்லாம். சரி, ரவிட்டு சொல்லிடுங்க. ரவிட்டு சொன்ன, ரவியோட ஒய்ஃபு பத்மஜா இருக்காங்கல்ல, அவங்க பேஷண்ட்டு, அவங்க தான் ஏற்பாடு பண்ணாங்க. சொல்லிடுங்க, நான் விட சொல்கிறேன், மெயின் இதுலேயே போட சொல்லி. நீங்கள் எனக்கு கொடுத்துட்டாலும் போட்டாச்சு. லைவ் வந்துச்சா? முடிச்சா? பரவாயில்லையப்பா, தமிழ் பரவாயில்லையா? தமிழ் பரவாயில்லையப்பா? ஏதாவது தடுமாறுனா ரைட். உள்ள அந்த சாதகம், அந்த வீரமணி ராஜு அவங்கள வச்சு பேசுவாங்களே, அந்த பயிற்சி எப்படி உரையாட போகும்போது வரப்போகுது. நூற்றுக்கும் மேற்பட்ட மாணவர்கள் அதில் 100 பேர் இருக்காங்க உள்ள கிரௌண்ட். நீங்கள் உள்ள போட்டோ கூட எடுக்க 100 பேர் இருக்காங்க. ஏன்னா நாங்கள் 100 பேர் 150 பேர் நேற்று எக்ஸ்பெக்ட் பண்ணோம், 100 பேர் வந்திருக்காங்க. இந்தியா முழுவதும் ஆமடாபாத்
vision, but otherwise we in the OPD when we do it via the nose through the flexible laryngoscope.
Okay,
and
okay.
Once the larynx is thoroughly being visualized, then we start our injection.
Oh, okay.
Is it clear?
Yes.
Clarity? Yes, sir. So
is it a forensic specimen or an anatomy formalin preserved on?
what is it, Dr. Vivek? Is it preserved specimen? Formalin preserved specimen? Yes, sir. It's a formalin preserved specimen.
Okay.
Yes, sir. So right now the larynx, I think we need some little bit of focus here. Can you focus at it? This one, this black.
Dr. Rajida.
Yes, sir. So this is a 70 degree.
70 degree.
It's
70
a
degree.
70 degree
This is
strobe.
closer. No, this long. So
Stroboscope.
yes, sir. Putting an instrument there in the larynx so that I can show like this. Can you hold the scope like this? Yeah, like this. Like this. No, this one. Right.
வந்துட்டாரு சந்தா வந்துட்டார் அடிச்சிட்டு இருக்காப்ல சந்தா உதயா. ஓகே ஓகே.
Or vocal cord would be, and I think this information is so important, not only for your thyroid injection, I mean the plasty, but also for your suture cordopexies. Suture cordopexy, when we do, we need to insert the needle from outside, sir, and the location of the vocal cord, having an idea that they are not in the middle. Let me just emphasize. Normally, I always prefer the cricothyroid instances where the patient is really apprehensive or really obese, bulky. We are not able to see, or certified cartilages also you can attempt, might be a little bit difficult as in against the non-calcium. This is 7 mm because you don't want to be too anterior. Too much of injection in the anterior part will actually worsen the voice. So you want more of it to come into the posterior part. So I'll rather stay in the posterior portion rather than getting too ahead and close to the anterior commissure. Any swelling near the anterior commissure will worsen the voice more than it is expected. So just to stay away from that area, I'll choose a safer area, which should be around 7 mm from the anterior commissure, more so in the males, also in the females I would. And then, rather than slanting it like any, keep it like this, I don't keep it like this, I keep it perpendicular, so that I try entering the vocal cord, and you can already see the,
Yeah, we can see the needle.
yeah, so this, the human vocal, the normal vocal cord doesn't pierce off like this, it is really tensile, elastic, doesn't give way through. This being a cadaver, it's very easily.
What size needle do you use for transthyroid injections?
Same sir, 25 and 27 gauge. In cartilaginous they are easy. Only thing is that they get blocked at times because of the cartilage, and if ossified, all the more the chance of getting blocked. In that case, you'll have to take it out or and do it again. So little bit messier as against the cricothyroid, but definitely you need to be aware about it, because there are instances wherein your cricothyroid might fail you. So you always need to have a backup plan. This looks good enough for a backup plan, sir. So can we appreciate the tenting, the movement?
Yeah.
Yeah. So once we are there, this is bang on that paraglottic space, sir. Just exactly where you want the injection to be, the material to be. And once you are there, you start injecting. I'm pretty sure it will start. Sorry, sir?
How much do you inject? How much?
So normally, one vial has 5 cc, not for everyone. At times I have needed 2 vials. So we don't stock more than 2 vials in our hospital. So I always, once we had an issue like we are having only a single vial, I did the injection, I realized it wasn't enough. I needed another vial, didn't have it in-house. So always, so this is one point, again we need to be careful, the injection is available. Don't expect that always one vial will suffice at times, and the cost also goes up. It is around 22,000 something. You need to be telling the patient at times one vial or even 2 vials might be needed. The cost might go up. So when the gap is bigger in older patients wherein the atrophy is also there, you might need a little bit more amount apart from that your routine 0.5 cc. At times only 0.2, 0.3 cc might also suffice. So it's not the amount, sir. It's the time wherein the vocal cord adducts beautifully. Definitely you are doing this procedure awake and you are asking the patient to phonate after your injection, and that's the way you realize how much will you be injecting. So once they phonate and the gap is closed, the voice is good, you stop there. A little bit of over injection won't be harmful, but under injection might not be a good idea.
Yeah. Second question was,
Yes, sir.
if there is a extrusion or extravasation, and
Keep your needle there, lateral to the vocal process, to start injecting your I think it's blocked. Push in this, no? Push in this here. No, just push. Yeah, push it, yeah, that's right. Blocked, huh? We have another similar needle. Yeah. No? Okay, but The needle is blocked, sir. You are seeing what we really face at times, the complications. The needle is totally blocked with the cartilage.
Okay.
Trying to push it. Yeah, now we are okay. So once again I poke in here through the vocal process. I'm inside there, then trying to push or I'd rather push it on the other side. Can you show that side as well? Can you see the bulge there?
Yeah.
So this is how the thyroid looks when you're doing from above. This is the picture you get. And on view, lateral to the vocal process, you inject. You can also inject it midway also here and then get done with it. This is the rinky space again. If you did it under local and general anesthesia for sulcus vocalis, you would have injected there also. Again, the needle is blocked, but anyhow. So this is the place where you would do the rinky space injection, and this is the place where you would do the paraglottic phase injection, either middle or you can come posterior like that. That is it, sir. The three techniques.
Thank you so much.
Thank you, sir.
Just a small request from you. What do you counsel the patient, and how do you counsel the patient for the sake of postgraduate? Just to know.
For this procedure, sir.
Yeah,
Yeah,
the
yes,
entire
sir.
procedure,
Yeah,
how long your injections are going to last,
Yes, sir. So normally,
how often do you repeat what you advise, all those things.
so we normally see a lot of unilateral cord palsy, sir, with more and more procedures. We're seeing a lot of it. So often it's iatrogenic. So counseling has to be really careful regards that as well. So I tell them that there are three options available. Either we continue, definitely all of them undergo voice therapy without any delay. They are started from day one on voice therapy, and along with that I tell them either they can continue the voice therapy alone and wait for the spontaneous recovery which might happen after the 6th month or so, or else we have temporary options like the injection which will help them to go back to their work straight away, giving them a normal voice. In the meantime, the recovery might happen or might not, and if it doesn't happen, we do have the permanent procedures which we can plan about 6 months down the line. And I usually tell them about the pricing and the ease of doing it in the OPD versus the fat injection in the theatre and the cost factors. I do tell them that hyaluronic acid injection has an advantage that regarding voice, most of the patients are really emotional about it. So they might not be, if the outcomes are not as expected, they would really get dejected. So I always kind of over-counsel them regards that. I tell them, if at all, even if you are not happy with the outcome, hyaluronic acid has the advantage that it is not permanent. So you will get back the original voice 6 months later. And if you are really happy with the outcome, we can always do a fat injection in the second sitting, or we can do a thyroplasty if the recovery doesn't happen even after 6 months like that. Most of them agree to the OPD hyaluronic acid injection, and many of them are getting insurance also for that. So yes, so that's actually helpful. And we have presbylarynx patients also. Because of atrophic vocal cords, they get this cough on taking liquids and weak voice. So they in fact, they are so comfortable with the hyaluronic acid because they get to go home same day. They can avoid a GA because they are all old patients. So they come as and when the symptoms recur. So we have patients who come after 6 months again for the injection because the cough on taking liquids recurred like that. And it is just an immediate outcome. Evening itself they'll be drinking that water and tea happily. So that is quite a good outcome there.
Very nicely summarized, Doctor. Thank you so much.
Okay, sir. Thank you, sir.
Thank you, Dr. Rajita.
Questions from the postgraduates? Any questions to be asked? Anybody has any questions? Thank you, Doctor.
Thank you, sir.
Thank you, ma'am, for the wonderful demonstration.
Thank you.
Excuse me. I thank Professor M.K. Rajshekar sir for giving me an opportunity to chair the session. And before the next thing, I want to make a small announcement with his permission. I invite all the delegates here, friends, everybody to our Rhinocon conference, which is the annual conference of the All India Rhinology Society, to be held in Chennai between November 28 and 30 at La Meridian, Chennai. Please come and join. We have nearly 30 international foreign faculties giving the scientific program. Thank you. Thank you, ma'am.
Thank you, sir. I request our HOD, Professor Dr. M.K. Rajshekar sir, to felicitate our moderators.
International faculty right now. Our in the Europe, the country Africa, the country so it's an international faculty. So teacher is very happy right now. So our next session will be a small sadhagam or a musical debate with musicians, Dr. Mr. Veeramani Raju and Sirali Shivatarbo and one super singer. So we'll ask questions, how they are maintaining the voice, then what is the remedy. That's the theme of this debate, right? And one more interesting case for younger generation, how larynx is very useful and also life very useful, and also how your name will be always static. Static na permanent irukum. Ipo nama tonsil operation pannona after 2 years he'll be unhappy if he gets cold cough. Sir, 2 years back you operated me, still I am getting cold cough. If I do SMR and after 2 years he will come to me with a nasal block, so still I have some nose block. Like that, our ENT surgery is because we are dealing day-to-day problem, not like hernia or hydrocele. Once we correct it, patient will not come to us. Recurrence comes only if the bad surgery. In the septoplasty or tonsillectomy, even if we do good surgery, the patient will come to us. But larynx is different. If you give voice or if you close the tracheostomy tube, patient will remember you lifelong. And one example, I'm telling you, this is a message for younger generation. I'm not going to trumpeting myself, right? Come. Right. This patient having tracheostomy and underwent thyroid surgery. After that, tracheostomy. About
2004 sir. Thyroid operation. அப்ப டக்கர்ஷன் பண்ணி சரி பண்ணிட்டாரு.
So patient had tracheostomy. After that, we did erythroidectomy. எப்போ பண்ணோம்?
2004.
2004, we did arithroidectomy, and after that we closed the tracheostomy tube. So right now, if manager,
2007 பண்ண சார். இப்போ பொண்ணு காலேஜ் படிக்குது.
So he is very happy right now. Right? So he has come all the way. 2004, I did surgery in MMC. Now, after 20 years, he is beginning me. So youngsters, if you do surgery tomorrow, the patient will be there after even 21 years or 20 years. That's a message. Okay. One more thing, very interesting. He is having show this. That I already told you I am not trumpeting myself. This is a message. You put MKR in this. Statue. So,
outside, sir. Sir? One more, sir.
And one more.
Please.
So he's put tattoo in my chest. So lifelong he will remember you. If you give good voice or if you close the tracheostomy tube, and lifelong patient will be with us. Wherever we go, he will be behind you. The patients are behind you. And he brought me more than 20 patients to me for various cases, for tonsillectomy, mastectomy, like that he brought. So that satisfaction and job satisfaction is more important than anything. Right? So this is what a message for younger generation. This was not given to me during my days. Right? So how about this? When did you do this? First, your voice therapy, your experience.
You mean with pertaining to singers?
Yeah.
So, see, singers or performers, they are a different class together. You have to understand each one is separate. What he sings is totally separate. It may be Carnatic music, it may be pop, hop, whatever. So you have to understand, have 1 or 2 sessions with them, do your laryngoscopy, stroboscopy, see the problem. Sometimes, once you have had access to that, I get my therapist also. He also joins me in assessing them. And then slowly we take them under this thing. And at times we take help of a musical coach also, because the voice therapist may not understand everything. So sometimes they have their own voice coaches. Yeah, so they are also bought in the middle.
Now voice modulators are there.
Yeah, you call them coaches, modulators.
Yeah, the super singers and all, there is a voice modulators are there.
So,
Voice therapist.
Very known and very to-do singers, they have these fellows with them. But some of them are physiotherapists who are turned into voice coaches. So there is always a gap between understanding of a medico, a voice coach, singer. So we try to get it together, and slowly then we start the voice therapy, but not immediately, not without our therapist understanding what is the requirement. Is it only to do with the high notes? Is it with the low notes? Is it with the amount of hours he's spending? So slowly, if something particular is needed, then they work on that.
Okay, right, very good. So very difficult to treat singers. That's all right. So what about this pathology like vocal cord paralysis, thyroplasty surgery? When you started doing it?
So we are slow. The general principle is very slow in operating any singer, even if it is a big polyp sitting.
No. Thyroplasty disease. I'm talking disease.
When
did you start?
When did I start?
Yeah, your experience.
1996. So we started our thyroplasties in 1996.
Okay.
That time I was in AIMS. So that time we started, and it has gone on since then.
Right. Injection laryngoplasty.
Injection laryngoplasty about 2000.
2000.
2000. Right. Office-based procedures maybe slightly later. Our standard was fat injection. But now we do a lot of office procedures. Botox, steroid, your Restylane. routinely
கிளாஸ் நிற்க சொல்லுங்கள். அப்போ தான் கொஷின் கேட்குறதுக்கு நான் ஃப்ரேம் எடுக்கிறது ஈஸியாக இருக்கும். யார் ஸ்டாப் பண்ண சொல்லுங்கள். ஸ்டாப் பண்ணுறாங்களா? ஓகே ஓகே. கொஞ்சம் தள்ளி மேடம் அதே மாதிரி யாரும் கிளாஸ் பண்ண நல்லா இருக்கும் மேடம். ஃப்ரேம் அப் பண்ண ஓகேவா?
London Muruga, Lord Muruga, London Muruga. In the chambers of my heart, a shrine I have for thee. Come on, Lord, come on, light, come down, in the chambers of my heart, a shrine I have for thee. Come on, Lord, come on, light, come down,
His father.
The candles of my love are burning bright for thee. Come on, Lord.
At the age of 17 or 18. Go on.
The candles of my love are burning bright for thee. Come on, Lord, come on, light, come down,
Padma Shri Kalaimamani Dr. Sirgali Sivachidambaram sir. He is a renowned playback singer with an internal medicine degree. He is the son of legendary singer Sirgali Govindarajan sir. He is celebrated for devotional, classical and movie songs in Tamil. He was awarded the prestigious Padma Shri and Kalaimamani award among others. He is a regular performer in national conferences.
More than that, he is our MBBS doctor, MD General Medicine. MD General Medicine. He is one year junior to me. For more than 45 years we are together. We used to dance in inter-college festivals in MMC. Still I remember we were dancing 1.5 hours together. Thank you.
Kalaimamani Dr. Veeramani Raju sir. He is a devotional singer, philanthropist, revered voice in Tamil devotional music, especially Murugan and Amman songs. He is a recipient of the prestigious Kalaimamani Award for his contribution to music. He is known for soulful renditions and spiritual impact. He runs multiple charitable initiatives and spiritual service programs. He engages audiences through emotion-rich live performances across the globe.
He's an international singer right now. He used to go to all over Europe and London, America and everywhere. And during Ayyappan song, very difficult, Ayyappan season. So November to January, very difficult to catch him. So he sings in 4 or 5 temples per day.
Miss Lakshmi is a trained classical vocalist with a master's degree in Carnatic music, diploma and master's in Hindustani classical music. She has also completed a certification course from Delhi University in voice culture and techniques in Indian music. She is a vocal trainer at Zee Tamil and Malayalam Sarigamappa. She is also running her own music school in Chennai for the past 6 years. She is also the voice behind the popular 92.7 Big FM title song in Malayalam, Tamil and Telugu. Now on the opposite side, we have our laryngologist, Dr. Rajita Binu Krishnan, Dr. K.K. Handa sir, and the sleep language pathologist, Ms. Janisha Mary Joseph. The moderator for this session will be Dr. Raghavi.
Good morning, everyone. So now we start. First question.
Good morning. So I welcome you all to the Sadhaka Sanvada, a musical crossfire. where art meets anatomy and melody meets medicine. Today we have the rare privilege of bringing together our legendary artists and experienced laryngologists in one space to explore our voice, which is not just as a musical instrument, but also as a living, breathing and a delicate masterpiece. So, the first question is directed to singers and music directors. How do you train and care for your voice daily, especially during your heavy performance schedules?
Wait a minute, Raju. So he sings 4 or 5 songs by kacheris during Ayyappan season. How do you maintain your voice? Solunga.
Cross பண்ணாதீங்கண்ணா.
Sir, first of all, it is God's grace.
Oh, very good. That's a good answer. Right.
To maintain our voice, அப்படின்னு பார்த்தோம்னா, like usually, as per your instruction, no ice water, no cold drinks like that. Ice cream, முன்னாடி சொல்லுவார். Ice cream, ice water, no. அதை விட ஒரு முக்கியமான விஷயம் எங்க டாக்டரோட இன்ஸ்ட்ரக்ஷன். கச்சேரி இருக்கிற அன்னைக்கு we keep silence. மௌன விரதம் கச்சேரி ஆரம்பிக்கிறதுக்கு முன்னாடி. That will be very useful for us. கொஞ்சம் பேசாம இருந்தோம்னா definitely evening we will get some power of voice. So as per your instruction I am following till now, sir.
Very good, very good.
கச்சேரிக்கு முன்னாடி 3 hours முன்னாடி நம்ம சாப்பிட்டுட்டு தூங்கிட்டோம்னா ஈவினிங் எம்டி ஸ்டமக்ல ஒரு வாய்ஸ் எதுவுமே பேசாம வாய்ஸ் ஸ்ட்ரெயின் இல்லாம இருந்தோம்னா ஈவினிங் ப்ரோக்ராம் will be நமக்கு ஸ்மூத்ஃபுல்லா இருக்கும் வாய்ஸ் பாடுறதுக்கு ஸ்ட்ரெயின். ஏன்னா இப்ப நானு எங்க அண்ணன் அவர் வந்து உங்களுக்கு டாக்டரா தெரியும், எங்களுக்கு எங்க ஃபேமிலி சிங்கர் அது. அப்போ எங்க அப்பா இவங்க அப்பா எல்லாமே அவ்வளோ க்ளோஸ் ஃபேமிலி ஃப்ரெண்ட்ஸ். அப்போ நாங்க 2 பேர் பாடுறது எல்லாமே ஹை பிச்சில் தான் பாடுறோம். அதனால எங்கள்கிட்ட கேட்கறது எங்கள்கிட்ட கம்மியா பாடினா ஜனங்களே ஒத்துக்க மாட்டாங்க.
ஏன்டா இப்படி 4 கட்டையில போடுறேன் அப்படின்னு அப்பா திட்டுவாரு.
அது மாதிரி இல்ல ஒன்னும் இருமுடிதாங்கி அப்படின்னாலும் ஒத்துப்பாங்க. இருமுடிதாங்கி என்ன சார் இந்த பழைய ஃபார்ம் இல்லையா சார் அப்படின்னுவோம். ஸோ அதுக்காகவாத நாங்கள் மெயின்டைன் பண்றது எங்களுக்கு வெரி யூஸ்ஃபுல். we are living with we are singing with ENT doctors. உண்மையிலே அதான்.
It is a message for ENT surgeons. Thank you. So younger generation, so you will get also singers in your life. Don't worry, right? Next.
Laryngologist, what are the most common voice disorders which you encounter in singers and voice professionals, and how do we prevent them?
So, see, there is a persistent overuse of your voice. You have to accept this is your profession. Commonest thing we will probably get are vocal nodules, early nodules, and your symptom may be your pitch breaks in high notes. The second thing is you start off fine, but after some time your voice, the quality goes down, and though you will not accept it, I am supreme, my voice can never go wrong, I am take care, but it happens in best of singers, and by the time they come, sometimes the lesion becomes too big. It may be a vocal cord polyp also. We have seen singers, quality singers who are high professionals, they have come out with large polyps which have been ignored for 2-3 years unless it becomes very bad. So you can see here you have a vocal cord hemorrhage. Now hemorrhage is also very common. You go to a performance, you do your best, go full throttle. The next day your voice is gone. This is the hemorrhage on the cord.
Hemorrhage is the vocal cord.
And this is a sort of a medical phonosurgical emergency. Because you will not be able to sing your next performance. So you have to be sensitized, these things can happen.
See, the hemorrhage occurs in the vocal cord, right?
The red thing is the hemorrhage.
How we maintain in singing, sir?
Yes, so
we should not sing in high pitch, sir.
No, it's not. You don't sing in high pitch, but how much you sing. You must know your limitations. Like my body, I am 60. I'm not what I was 40. So also with age, there are things happening in your vocal cords. There is a condition called presbylaryngeus. Like your eye number, the vocal cords. So you have to modulate your singing and number one as per the age. Secondly, what is the level if you are singing very high notes? going all out, what is the level at which your difference starts coming? So you have to curtail your high note singing, doodling, high note singing. Then a performer must cut down his social chit-chatting. You do your professional work, but cut down on today is the time of WhatsApp. You communicate with your family, colleagues, everything. You cut down your social amount of talking you do. Then few other things. A steam is a very good natural way of, say, you take steam twice daily. From your nose down to the throat, it's a very good natural way. Then do not gargle. Gargling puts pressure on the vocal cords.
Oh, do not gargle.
So the message is youngsters, no gargling, and steam inhalation is best for the singers or voice tiring. This is a message for the younger generation. Okay.
In some seasons, like in Murugan season, they call Murugan festival and Ayyappan season and all. So Navaratri also we will be having regular programs, daily programs, especially in Ayyappan season. I start my programs by November 16th. So I will finish the programs by January 21st. So up to that, even in Saturdays and Sundays, we will have 2 or 3 programs, morning and evening and night also. So in that 3 months, we will performing more than 100 performances. So daily we have to sing at least for 2.5 hours or 3 hours.
No, this is overdoing. What you need to do is you form a group where there are 4 or 5 singers. Say they want to see your face, the audience. But you have 4 or 5 people. Instead of singing 10 songs in one performance, you sing 2 songs. And let the others, they are happy seeing you. You can't do the amount of singing you are doing because next season, what season you said, you will not be able to sing.
So this is you have to maintain your voice.
So then we will go to MKR.
Anyway, good. Very good. Next question.
This question is directed to singers and music directors. Have you ever experienced any voice issues like hoarseness or vocal fatigue? If so, how did you handle them? Medically or intuitively?
What is your opinion? Being a doctor,
A very good morning to everyone and to the respected doctors assembled here.
It's a medical forum.
It's a medical forum.
It's a kacheri or this one.
I just wanted to know how many non-medical people are here around.
Only how many people?
No. So, considering this medical forum pertaining to voice, our family and the tutelage which we belong to insists on respecting the voice and disrespecting the noise. So the nature of the music we sing decides on the voice. That's number 1. Number 2, as dear brother said, all of us are busy and we keep singing around, and I see patients in between. That is a different strategy all along. But to take care of the voice, what we were taught was basic hygiene of the oral cavity, because music is not vocal cords alone. It starts from Nabi, Hrit, Kanta, Rasana, Tyagaraja Swami's Kriti is there. Music is, you personify Mada, Pida, Guru, Devam, Shruti Mata, Laya Pita, Abhyasa Guru, Jnanam, Sahitya Jnanam, Devam, Mada, Pita, Guru, Devam, Garbari. To take care of a good voice, you take care of the good apparatus. Do pranayama exercises to keep the breath. Breath control is important in singing. Number 2, regarding the vocal cords, the oral cavity, we were taught to do it with saline, with warm saline. You need not overdo it with shouting, gargling. But gargling is also, I sincerely feel from our days, is the best way to maintain your oral cavity, avoid infections, all the pus follicles and things like that. Anything, your mucus, your infection, everything is gone. Your mind is free that your voice has been, your oral cavity has been taken good care.
So, one message, oral cavity is more important.
Oral cavity is naturally important because the palatal, as far as Indian music is concerned, the palatal modulation, the uvular modulations for the sargatis, and the whole pharyngeal apparatus should cooperate with the voice box, which is important, and the pranayama. Karvayoda paadradhu solvaanga. So adu vandu paadumbodu you can give a mild vibrato which comes by training. The vibrato starts from the navi. Sa re ga, and ஒவ்வொரு ஸ்வரத்துக்கும் ஒரு கமகம் இருக்கு. Indian classical, South Indian, Dakshina Bharata Sangeetam relies upon the Gamaga Bhava and Karvai based Sangeetam. As age goes up, as we grow up old, as we grow older, there's a lot of sarcopenia things happening everywhere. That happens even with the larynx and even with the vocal cords. It's normal and natural for the organs to get tired. So to rejuvenate the concept of music, the concept of your thought about the song, the thought about the performance, the whole strategies change. That is when you get newer inclusions. Your sishyas come up in the field. They are relatively young to carry on your torch, and you can give them a separate system of music which helps in modifying their styling in music. So you get newer concepts of doing a fusion, experimenting a new theme-based music concerts, having your own compositions with your own range. So Shruti is basic voice. I think most of, more than the doctors assembled here, even the musicians and music directors need to know the current trend, because every voice is considered with qualities like resonance, pitch, timbre, which are very essential. And the voice is ஒரு ஜீவன் இருக்குது, அந்த ஜீவன் தான் timbre, and it should be resonating. Na ஒரே over resonating இருக்கக்கூடாது. So that is the thing which is gauged and practiced during our training. Our gurus help us in getting us into the field of adjusting and keeping you in the right path to keep all these things intact in voice. And now I am coming to the question. Voice issues, there is no musician, no singer without voice issues like hoarseness, fatigue. It happens.
Your voice also
even it gets hoarse after if you are continuously, as he said, he does 3 concerts. I don't have the guts to do 3 concerts. The syllabus is entirely different. His syllabus is different. My syllabus is different. But when we carry on with the music, the message has to reach the masses, the learned masses, the illiterate, literate. It has to reach the whole society. That is the aim of the music. Then you have to exert at certain points. When the emphatic songs, where you have to emphasize on the raga structure, or when you have to emphasize on certain things, you have to compromise with the voice levels. And more than everything, the voice responds to the ambience. Now we are seated in a well audio insulated auditorium with a very good microphone. I cannot expect the same microphone, same ambience, same audio treated halls. We sing in the open stages, in temples. In temple concerts, we sit on a stage, and if the temple is an affluent temple, they bother and arrange very good audio systems. Otherwise, if the audio fails, if they were to have 2 small speakers without any feedback monitoring, we'll have to exert across. And for loud voice singers, for open throat singers, we knew only voice in 2 strategies. One is natural open throated voice. The other one is falsetto singing. And falsetto singing, most of the times in a very small scale of interval, or very soon after the concert, it results in hoarseness and fatigue of the voice. Natural open throat voice singers, though the initial phases maybe a bit gruffy, but as it warms up, it opens up. And I'm sure everyone knows about the great maestro Madurai Somasundram. His voice, Maradamalai Mamaniye Murugaya. If you talk to him in the morning, he was very busy with his concerts, and every concert goes up to 6-7 hours. That was the style. Minimum 6 hours. So his syllabus was such that raga expositions, and he has to manipulate with so many things. Extensive singing, extensive use of his vocal cords. While he starts the concert, the audience will be worried, especially the newer audience. Well, how is he going to complete? Thambi, அப்படிதான் கேட்டு போவார் ஸ்டேஜுக்கு. ஸ்டேஜில் போய் உட்காந்து ஃபர்ஸ்ட் பாடும் பொழுது சங்கதிகள் போடுதா இது நான் கிளீனா பாடுறேன். அவரு வந்து கிரஃபியா இருக்கும், கரகரன்னு இருக்கும். அந்த சட்சமும் பிடிப்பாரு. It's a sort of an exercise which worked on him. Right. He tries to bring the vocal cords in a position.
That will show you the next.
Yeah, and get that into full control. I think I'm taking a bit longer time. My brother's intervening just to say you have to go to the next one. If so, I've not experienced not much of a Wurzer style of thing, because I've seen seniors singing, and with the confidence, if you start singing, even if the first song is not up to the mark to your expectation, you can definitely make it in the second song, because mind is the force behind the voice, as far as I am concerned. That is why all vocalists, if you see, they are all more attached to godliness, spirituality and things like that, because nothing is in our hands. Our music, only our presence and vocal cords are there. But the control of our respiration, the control of the vocal cords, we attribute it to Almighty.
This vocal cord, you see.
So the next question is to our laryngologist. How do you differentiate between organic and functional voice problems in professional voice users?
Sound. See how the vocal cord vibrates. There is a postation drip also there. There is a mucus between the two vocal cords. So how you treat some singer comes to you?
Yes, sir. So like organic vocal cord disorders usually have some swelling, some lesion in the vocal cord, either a polyp or a cyst or some nodule is there like that. So means the voice is always hoarse, not only during singing, but even talking the voice is hoarse. But for functional voice disorders, like most commonly what we see in our clinic is muscle tension dysphonia. Means not only the vocal cord, but the part above it, the false cord also adduct while singing. So that happens because of overuse, strain, and because of continuous high-pitched singing. So what is that? That is what we see more commonly, muscle tension dysphonia, which is more of a functional voice disorder. Means the vocal cords are normal, but the technical issue is more of there. Moreover, the anxiety, the performance, the continuous back-to-back programs. So this is called as dysodia, means the speaking voice is normal, but the singing voice is abnormal. Dysodia we label it as. So it is pretty much straightforward. With your stroboscope, your endoscopy, you get to know whether the vocal cords are normal or not. Once you see the vocal cords are pretty much normal, then you start checking out on the technical issues. Okay, there might be a muscle tension dysphonia, so it might be either the false cords, like we call it type 2 MTD, or also the anteroposterior approximation, that is the type 3 muscle tension dysphonia. So, and along with that, at times you can see pharyngeal squeeze. Means what we mean by the pharyngeal squeeze is that the pharynx also contracts at the height of high-pitched singing. So we normally do a singing VLS on our singers. We make them sing at the time of doing the scopy. So that's how you pick up all those functional disorders. Accordingly, our therapist treats them like that.
Thank you. Very good. Thanks.
Next question to singers. What are some myths and misconceptions that you have heard about voice care among performers.
Misconception.
So yeah, I've heard a lot of myths and misconceptions. Again, just for the background, I've been through a vocal nodule treatment and all that.
You are?
Very good. Yeah, so basically, I'll first answer the question. So the myths are, one I've heard is practice. I've heard Tamil la solluvanga pada pada ragam, mooda mooda rogam. So I agree with that, but how much you pada pada matters. That's something that I've felt. I generally compare the vocal practice to running a marathon. So giddy start panni, you can't just okay innela marathon order sorry, I can't just start running 40 kilometers. Yeah, it's a muscle, so you need to, if I am going to start performing, I believe that I have to gradually increase my performance stamina. So maybe I will start off with 5 to 10 minutes of practice every day with adequate rest, and then I will gradually build it up to the amount of performance I will have to do on stage. But if I have to do 3-4 hours, I have to build it up to 3-4 hours, not start 3-4 hours of practice every day, because then I'm going to strain my voice. So that's one thing I've heard. And then the natural remedies to...
That will come,
No, I'm saying one of the myths, natural remedies to serious throat issues, throat infections. Practicing during throat infections is a big no-no. I've seen lots of students and musicians do that. I tell them to take complete voice rest, but even then they are like, it's okay, phlegm irukku, so paadalam. Phlegm irukku na paada kudadu. You just take. I always refer it to doctors, but these are the people are afraid of ENTs, people are afraid of going to a doctor, and also afraid of the laryngoscopy. I've heard people who lost their voice due to endoscopy and all. We'll talk about that later on, but yeah. So these are the common stuff I've heard as a myth. Thank you. To laryngologists and voice follow pathologists, what is your approach to counseling performance with early vocal fold lesions? Those who wish to avoid surgery, that is, they want only medical treatment.
What is it? So early vocal nodule, how you patient will come, she's an audiologist and speech therapist. So what your suggestion?
So sir, in early vocal fold lesion cases, like maybe an early nodule, let's take an example. So in those cases, we'll first take their history about lifestyle habits will be the first thing that we take. Because in most of them, we know that maybe their lifestyles would be affected. So that would be the first thing. And the second most thing is their vocal habits. I mean, the voice use, what is their profession is the first thing we ask. Because if it is a teacher, we ask them which is the subject that they take and what is the type of classroom they are taking the classes. And if it is singer, we ask them for how much hours and what is the frequency of the this performances that you do. So we ask all those. And in case of a singer, we also ask them, do you do any vocal warm-up? First one. Second one, are you a trained singer or not? Because in some cases, we have always seen that if it is not a trained singer, they have all those, faulty use of voice. So that can actually create and trigger all these problems. And along with that, we would also give them many voice therapy exercises, like lax walks, that is stroke phonation. So initially, we start with voiceless exercises. That is what we prefer at our center. Personally, I always think that when a patient with a voice patient comes to us, they initially present with a lot of anxiety and stress. So if I give them maybe a voiced exercises initially, that would increase their stress and they'll tell, I can't do this, I'm not able to do this, that is why I'm here to you. So what do we do is for a week or maybe 1.5 weeks, I give them a voiceless exercises and then we move on to further voiced exercises. So that might include voiceless lip trills, voiceless tongue trills and lax walks, laryngeal massages. And we ask them to avoid a lot of foods, spicy foods, cold foods, carbonated drinks, caffeine. And also voice rest, yes, we advise voice rest. And also initial absolute voice rest maybe and then relative. that is how we counsel them. So emotionally also, first thing is to voice patient, talk to them a lot. Talk to them, know their problem. We always say voice therapists should be counselors too, because they come to you with a lot of stress. If we just make them sit beside us and like, okay, do this, do that and all, that creates more tension on them. Talk to them, know their problem, and also advise accordingly.
Okay, brother.
Yeah, that's a very good piece of advice. Thanks for the advice. But earlier days there used to be, musical learning used to be in Gurukula Vasam. The Shishya lives his life with the Guru, learns the music, learns the lifestyle. And regarding myths, a half a glass of rasam is very soothing for a fatigue case.
Grandmother treatment.
Like grandmother treatment. Even now, popular singers, I see them switching on a small piece of strepsils before attempting to sing in light music stages. The last stage is probably people drink hot water. As Sir said, when they drink hot water in between, they do some steam inhalation. If I have a sip of a coffee, I have a coffee steam inhalation, coffee flavored steam inhalation. It clears up and it comforts. Regarding the training aspect of voice fatigue, I think she was perfect in her expressions that you should not burden them up with the exercises. Pada ragam, muda ragam, ne thoda kattirikkum bodhu avane erkanave he's with voice trained. Niki poi niki the varnatha paadadunu. But in Gurukula Vasam style, every composition had a meaning. Sarali Varsai, Chanda Varsai, Sa Rigama Pada Nisa, Sani Dapa Magarisa, Sarali Varsai in different combinations in 3 speeds. I think you all must be knowing it. I don't need to express it a minute. The next one is Janda Varisai, where the swaras are double. Sa sa ri ri ga ga ma ma pa pa da da ni ni sa sa. And there is a sadagam style called Agar Sadagam. Adu oru vishayam. Plus the next lesson goes to Varnams. When they start teaching the Varnams, they teach the Raga Bhava, they teach the lyrics, and they teach how to sing and warm up the vocal cords. Varnam is basically meant for warming up session for the Vanajashiro Irire Amorvane. This is Kalyani Raga Varnam. Varnam is practiced in Agara for voice warming in the practice sessions with the gurus. It specifies 2 things. Number 1, if he is to expose himself as a raga exponent, in the evening, the concert stage, he can use these phrases to elaborate on a raga. At the same time, the same varnam, the same lesson which is taught in the Indian classical thing, likewise even North Indian Hindustani music has exercises and compositions and various dhats which concentrates on voice warming up. So that's why Indian singers, wherever they go, they may go to USA, they may go to Sri Lanka, they may go to East, West, wherever they go, their concerts never fail because of voice reasons. Their concerts may have different mixed impressions because of the audio system. They are not used to voice-based balancing. So, generally, the gurus, the Gurukula Vasam style, live the life with the music. They teach us how to warm up. They teach us what are the expressions you should do, what are the things you should practice. Like the student doesn't sing properly, they have their own methodologies of punishing him. The secret is the rasam. It manages a part of the treatment also. And that was an era when we never had all these copies and the treatment strategies. Adimaturam. Adimaturam, there's a herb which was used for, they used to say, they had various myths about the nambikaigal vera adimudaratha pottu po sangala paadidalam. More than the adimudaram, it is the confidence which that herb brings. It's the mind which clears up, then the voice. Like now we are in a scientific area, we are with the latest equipments. You guys are very lucky. I'm very happy that the students here are learning the best and latest things from technologies, latest medical inferences from learned professors here. And one more thing which usually I've seen my seniors do is, if they travel on the train, they communicate only with expressions. They will not open up their throat with the train noise. Even when the TT comes, they'll ask us. It's only the sign language which speaks. They will not talk. Likewise, in the airport, when there is any atmosphere with noisy atmosphere, it is bad not only to the ears. Now you have very big loudspeakers blasting music all around, discos blasting, and I'm sure the current generation, they will definitely land up with ENT problems later on, because the amount of noise they are hearing in the name of music and voice, it will definitely, don't worry, you will have a flourishing practice. Thank you.
Thank you. Very good, because since I called you, it's a doctor come musician. That is very important. So he knows everything. So thank you. Right. So you can see on puberphonia how we are changing it. You see now. That, it's a female voice. That's a voice has not broken. So musicians must understand. This we are going to develop. How can you reduce the pitch and
voice surgery?
It's a male voice. Right.
நான் transgender என்னோட தோற்றம் பார்த்தீங்கன்னா ஃபீமேல் இருக்கும், ஆனால் வாய்ஸ் வந்து ஜென்ஸ் வாய்ஸ் இருக்கிறதால சர்ஜரிக்கு வந்திருக்கேன். பாலாஜி ஹாஸ்பிட்டல் வந்திருக்கேன். நாளைக்கு மண்டே சர்ஜரின்னு சொல்லியிருக்காங்க. இது வரைக்குமே எனக்கு மேல் வாய்ஸ் தான் வந்துட்டு இருக்கு. சர்ஜரிக்கு அப்புறம் ஃபீமேல் வாய்ஸ் எப்படி இருக்குன்னு பார்க்கலாம்.
So see now. So vocal cords are normal. It's a transgender. So it's a surgery. It will take surgery only not more than 40 minutes. So suture, thyroid and cricoid. Right. Approximation using 10 proline. I already told in the morning, since for you only we are screening again. So we are tightening thyroid and cricoid cartilage. I think Siva will understand. This is a thyroid cartilage. This is Adam's apple. This is a cricoid. This is a tracheal ring. This is a cricoid. Cricoid is up. So both are up. So pitch, vocal cord lengthen. So pitch increases. So see what? So what is the So hereafter, the artificial intelligence is going to come. So voice modulator, I think we'll come reduce the pitch, increase the pitch, and 1 millimeter reduce the pitch, it will improve the voice. Like that we can do it, I think.
We already have technology that exists. There is software called Melodyne, vocal tuning. So that is already used in film songs to pitch correct the singing and all that. So my husband, he's actually a person who does Melodyne. He's also a musician. So when he does vocals, I listen to how you can just talk and then it can be converted into music at this point. I mean, you will know at this point, but at certain places you wouldn't. That's how these most film actors and all are performing right now, in perfect pitch and all that. Yeah.
This surgery I have not learned. During my MS postgraduate, I have not. I don't know anything. Did not know anything about it.
Oh.
Now we are doing it after 40 years.
Yeah,
I think after 40 years everything will develop.
No, I've trained.
I will become a Veeramniraji like that. No? I will sing all songs, high pitch songs. No,
if you have the right technique, you can.
Yeah. Thank you. Thank you all. Thank you. Very nice discussion. So we all enjoyed with the musicians, and our laryngologist. I'm very thankful to our Veeramani Raju and my brother Siva and my Lakshmi, very good. Lakshmi. So I'm very thankful to our laryngologist and audiologist also. Thank you all. So now we take one group photo.
LED off பண்ணு. மேம் இது ஆஃப் பண்ணு. LED அந்த இது ப்ரொஜெக்ட் டிஸ்ப்ளே ஆஃப். ஒன் செகண்ட் இந்த ப்ளூ லைட்டை மட்டும் ஆஃப் பண்ணுங்க. ஆஃப் பண்ணுங்க. அந்த செட் லைட் போட்டுருங்க. லைட் செட் லைட் பண்ணுங்க. அப்படி மேடம் கொஞ்சம் வந்துங்க மேடம். சார் இங்கே பாருங்க சார், வீடியோ சார்.
கட் பண்ணி அங்கே போகணும்
வச்சுக்கலாமா? எங்கே போய்
மைக் எடுத்து
செப்பல் போடு, ஃபுட்பால் போடு. செப்பல் போடுங்க.
Thank you for the wonderful session. I request our singers and the laryngologists to release a book titled Voice Restored, A Surgical Guide to Thyroplasty, written by our faculty under the guidance of our HOD, Professor Dr. M.K. Rajashekar sir.
அது திருப்பி மறுபடியும் எப்படின்னு பார்த்து மேடம் யார் மட்டும் கிராஸ் பண்ணாமல் பார்க்குறேன் சார். கொஞ்சம் வந்துடுங்க சார். சார் ப்ளீஸ் சார் உட்காருங்க சார். இல்லைனா ஜாயின் பண்ணி வாங்க சார்.
But in front of Hyundai, we are very simple. He released the same type of book in 2016 itself. He has presented me in 2017.
சார் வீடியோ பாருங்க சார். சார் எங்கே சார்? சார் இங்கே பாருங்க சார், வீடியோ பாருங்க.
We will now have a short break before we continue further sessions.
வாய்ஸ் ஆஃப் அஸ்வின் பேசுகிறேன் போட்டு வந்து வாய்ஸ் ஆஃப் ஆமாம் அஸ்வின் பேசுகிறேன் முதல்ல கட் பண்ணிக்கலாம் பிரேக் ஆகும் டைம் ஆகும் கட் பண்ணிக்கலாம் பாலாஜி ஹாஸ்பிட்டல்